What are my options? Well, first of all, once you enroll in Original Medicare, you're on your way to great coverage. The only issue with Original Medicare is it doesn't include prescriptions, and there's a lot of gaps in coverage. That's why bottom line is most people go one of two roads. They either go with a Medicare supplement to fill the gaps of a Medicare plan. Another word for a Medicare supplement is a Medigap plan. And if they get that Medigap plan, they get a prescription drug plan too for their prescription. So they have three cards. They have their Medicare card, they have their Medicare supplement card, and they have their PDP, which is their prescription drug card. That's one road. The other road is getting what we call a Part C, which is a Medicare Advantage prescription drug plan, where you're assigning your Medicare over to the insurance company. They're becoming primary now, and it's all in one. It's inclusive. So the coverage has to be at least as good as Original Medicare, gives you a maximum out of pocket, some predictable co-pays, includes your prescription drug coverage. So that totally limits your exposure, and it's the most economical way to go generally. Then we go to the right side of the flow chart. We have your Part B, which is your doctor, and that's your hospital outpatient. So that includes your doctor services, your preventative services, your home health services. So what isn't covered by Original Medicare? Well, your Part A deductible, for one, which is $1,288, your Part B deductible, which is $166, and on your Part B side, once you meet that deductible, which isn't covered if you just have Original Medicare, you're also responsible for 20% of the charges, plus as much as an additional 15%. That's called excess charges if your doctors don't accept Medicare assignment. Also, prescription drugs are not covered under Original Medicare. The two ways that people go to fill all those gaps or limit their exposure is the Medicare supplement, aka Medigap plan, with their Part D drug plan, plans A through N. They're all standardized by the government, and they fill those gaps. The other side of the coin is your Medicare Advantage plan. That's your other major road, other than having your Original Medicare, where the government determines whether a Medicare service is eligible or not. With the Medicare Advantage, now the insurance company is your primary payer. If you have Original Medicare, the government's paying the portion of the bills, that 80% minus the deductibles. If you have a Medicare Advantage plan, the government isn't paying your bills anymore. They're paying the insurance company now. They're kind of, in a way, outsourcing you. They have to cover at least as much as Original Medicare. They limit your exposure, have a maximum out of pocket, which Original Medicare does not. The vast majority of these plans, not all of them, but the vast majority are HMOs. So you have to choose a primary care doctor and get a referral to a specialist. So there's a little bit more of cost control and a little more handcuffs with the insurance company when it comes to the Medicare Advantage plans.